The Republican side, Louisiana Congressman Charles Boustany is with us. He's a member of the House Ways and Means Committee, also a heart surgeon, 14 years. Currently serves as the only Republican doctor on the committee and joins us live from the Rotunda. Great to see you. Thank you.
Thanks. Great to be with you.
I know you're adding in some things to the Republican ideas on this matter. Give us some highlights if you could.
Well, first of all, we believe that we have to focus on the doctor-patient relationship because that's really the essence of good, high-quality medicine while keeping down the cost. Secondly, we want to build off of what already works. And given that 83% of Americans who currently have health insurance are very happy with it, meaning that coverage leads to good access to a doctor-patient relationship, let's build off of that. So if you look at the 47 million people who are uninsured, and break that down into the categories and target solutions to each of those groups, that's how you solve this at a fraction of the cost of what's being proposed by our friends in the Democratic Party.
A lot of politicking going on here on both sides. The White House just said through its spokesperson, if you guys have some good ideas, they're welcome on the table. They always say that. Do you feel included or excluded or something in between?
Well, House Republicans have been completely excluded from this. I've had 0 meetings with the president, and I've had extensive experience in health care. And I think there are several other of my Republican colleagues who are willing to come to the table and offer our ideas. But at the same time, we have been excluded from this. But we're going to continue to work with Blue Dogs and some of the new Democrats who are more business-friendly to try to come up with a compromise in the House.
What's the best hope now? I mean, they do have a majority, and if they can get the Blue Dogs on board with them, they don't really need the Republicans. What's the best hope that you have for some sort of compromise to get part of your message out there in this process?
Well, I think, first of all, we don't have the votes to stop anything that they want to pass in the House. So clearly what's going to happen will be that a certain number of Democrats, Blue Dogs, New Democrats, possibly others, will have to slow this process down. And that's what we've been saying. Mr. President, it's too important to rush through this. We have to get this right because health care affects every man, woman, and child in this country. It's a very important kitchen table issue. Let's get the policy right and get the cost under control and make sure this really leads to good, high-quality access to a doctor. Those are fundamental issues that I think every American cares about, and that's what we're looking for as well.
Some of the observers look at this now as some of the same ones did back in 1993 when this thing went over like a lead balloon, looking at it saying what part of what this is the party of big government is in a big fight against the party of big business. What happens if big government wins over big business here? What sort of fundamental change occurs as a result thereof?
Well, what we're looking at, again, is the American people will lose out. We're focused on helping American families and small business owners in particular right now because they're the ones really struggling with the cost of all this. And I believe we can tailor some solutions both to individuals and families trying to seek health insurance that leads to meaningful access to a doctor. Same thing for small business owners. And we've got a whole host of ideas out there. We're just trying to get those out there in front of the American public. And we believe that the longer this House bill sits out there and the American public actually sees what's in the bill, they're not going to like it. Because big government bureaucracy will tell you what kind of insurance you can have, and most of it will be government run. Big government will decide what kind of treatments will be allowed, getting between you and your doctor, and those are not the things that Americans want right now.
Congressman, it's great to see you. Thanks very much. Good luck to your side and the other on a compromise that works for all of us. Thank you.
Great. Thank you.